Okay, I'm going to record a session of removing Dewclaws. And again, this is something that has to be done for show dogs. I'm doing this as an instructional video for those who find that they want to do it themselves. You can certainly take them to the vet, but I think the trip to the vet is more traumatic than actually just doing it in your nursery, as long as you know what you're doing. But Dewclaws have to be removed because it's a vestigial toe. I'll show you what it is. It's a see this toe right here? You can see it. That toe right there is up on the side of the leg. And it's actually not attached with bone to the leg. And these toes, I had a champion Boston Terrier who still had her Dewclaws. She shouldn't have had them, but she jumped down off the couch and she caught their Dewclaw in an Afghan, and it ripped her toe half off, and she had to go in and be anesthetized and have that surgery done on it to repair it, and it was really traumatic for her. And this is something we're supposed to do for show puppies, so I just do it for all the puppies. Some people don't do it, but what happens is a lot of people don't remember to cut their dog's nails, or if they do, they forget to do that nail, and sometimes they grow around in a circle and actually grow back into their leg, which just sucks. So anyway, I'm doing Dewclaws. I'm going to show you how to do it in your nursery, and the only tools that are required are clean hands. You know, if you want to use alcohol wipes, you can, and some long fingernails. I've already done the first Dewclaw on this puppy's left leg. I'm just going to show you what the after thing looks like. That's it. There's one that's been done. And all I'm going to do is I'm going to flip this puppy over. So hold on to it. They hate that. They hate being flipped over, and they hate having their foot grabbed. But all I'm going to do is take my nails. You can also put a hemostat here, and you can clamp it down and flick it off. But I think it's cleaner, and they struggle less. See, she's just struggling because I'm holding her. I'm not doing anything. I just think it's less traumatic for them if you're not holding them with hemostats. We're all about no trauma. So I know I'm not doing anything. I'm just hanging on to you while I'm talking. Okay. So all I'm going to do is hold this. If I can hold this puppy's foot, is I'm just going to. This is a day-old puppy, so they don't really have much in the way of the nervous system going. And you know, you just pop it off. That's all there is to it. I've got one puppy over here that's bleeding a little bit, so I'm going to just put some quick stop on that puppy. But all I'm doing is just putting some pressure. And that's actually got alcohol on it. You don't see this puppy. This puppy is not crying. There we go. She's going to sleep. There goes her head. So, I mean, I've even got alcohol on this. You know, if you ever had alcohol against an open wound, it doesn't feel good when your nervous system is well developed. So that's why I really like to do this at 1 day of age. Or even, there's some breeders that do it right after they're born. But I like to make sure that they're thriving and nursing and everything. And there we go. Dewclaw's done. Puppy finished. And I've got one over here that's got a little bit of blood, so I'm going to go get some quick stop and put it on there. But that's really all there is to it. And again, please don't shoot the messenger, because this is just something we have to do.